Welcome to Path to Med, episode 3. I'm your host, Suhani Pandya, and today I'm really excited to introduce our guest, Fatima Bah, who's a third-year medical student at the University of Toronto. She completed her undergraduate studies in life sciences at Ontario Tech University, having earned a full-ride scholarship. And during her time at Ontario Tech, she conducted research in the aquatic omics lab, focusing on proteomics and genomics, which led to a publication in Frontiers. And in addition to her academic pursuits, Fatima co-founded the nonprofit organization Wellness of Women, which is aimed at empowering women and supporting local shelters. So, just to start off, what inspired you to pursue a medical career?
Yeah, thank you so much for your question and for having me. Deciding to pursue medicine was it took a multifaceted approach. One thing is, one of my weaknesses is I'm pretty indecisive. I'm still working on that. Growing up, I didn't know if I wanted to be a teacher, a lawyer, an engineer, a researcher, etc. But I feel like with medicine, it's such a holistic career that it kind of includes all of these different um, other careers. So, for example, um, as a physician, when you're telling a patient how to use a new medication, you take on a teacher role. But also, you want to be very involved with research. So you can also have a researcher hat, whether that's actually going into a lab or reading papers in order to have a better provide better patient-centered care. Another reason why I wanted to do medicine is more from an equity, diversity, and inclusion approach. Growing up, I didn't really see a lot of doctors or a lot of people in the healthcare field that looks like me. And representation is super important. It's not just superficial. For example, the maternal mortality rates of Black women, I don't remember the exact figure, but it was quite higher compared to other groups. Just I hope that I can kind of change this so that there's actually equitable healthcare.
From your experiences with med school applications, what do medical schools look for in candidates?
That's such a good question. We often say that the medical school application and process is kind of a black box because you don't really know exactly what they're looking for. However, there's a few things that people kind of use as resources or as a guide to kind of develop themselves to be a really good physician in the future. So, have you heard of the CAN meds before?
I think so, yes.
For the people who don't know what CAN meds is, it's a list of competencies that every physician or medical student should have and work to hone. So the six competencies are professional, communicator, scholar, collaborator, health advocate, and leader. I think I have all of them. And they look for this through various means. So one is through your GPA and your MCAT scores. So seeing if you're able to have good and strong academics is one, but that doesn't make everything. You don't want just a doctor who's able to pump out 100% on their test. You want someone who's very passionate and committed to the field. And you show this through other means, such as your extracurriculars. Um, and when students kind of get this confused, when we say like extracurriculars, it doesn't mean having a checklist of different things, such as volunteering at a hospital or shadowing, etc. It means they want to see that you can stay committed to a certain activity and paint a story for yourself. For example, for me, I was really passionate about equity and diversity. So a lot of my extracurriculars focused on that. And I tended to stay in one position for a long time and move up and take more leadership roles. So those are some main things they look for.
So I've also heard that there's an interview process and that they look at things like GPA and like your grades first, and then afterwards they'll sort of conduct an interview. Have you had experiences with that or?
Yeah, absolutely. Through we in Ontario we have the OMSAS, and then there's different aspects. So you mentioned correctly, there's your GPA and your MCAT scores. Now, depending on the school, they use the GPA and MCAT very differently. I think all across GPAs is you have a higher GPA point, but for your MCAT, for example, for UofT, they only have a cutoff. So once you meet that cutoff, good to go into the pool. However, for McMaster, they only look at your cars, so you should have a really high car section. Once you have those cutoffs, you have essays that you have to also write and your references. So for your essays, they'll ask different questions, again, depending on the school. And this helps to highlight, again, your different extracurriculars um, throughout, uh, since you were age 16, I believe. And then references is from different people who have known you through your different extracurriculars, school, etc. And at least with the OMSAS, what I like about it is it's not a letter, it's more so a survey. So it's more standardized. So if you have someone who's a really amazing or who can really write well, it doesn't put you at a disadvantage if you have someone who might not be the strongest writer. So those are the main components.
Yeah, so then the survey would be more like standardized and like they look more at the content then.
Exactly, exactly. They'll
Okay,
ask like,
okay.
oh, on a scale of 1 to 10, how well do you think the student is at communicating? I'm not sure. Students don't get to see the survey, so we're not sure what questions they ask.
Oh, okay, okay, that makes sense. So during your undergrad, what was your experience like conducting research and how did you decide what area you wanted to study?
Very good question. So, first, my experience was amazing. I love working in the aquatic omics lab. It was such a unique experience because I got to work with fish as my model, and because of the nature of working with fish, I got to do some field studies. So, going out on a boat into the lake and collecting samples or completing caging studies, which was very unique and different from a lot of people I've heard working in a wet lab. And I also got to use what we call liquid chromatography mass spectrometry. And it was such an amazing machine because you can really see a story of the fish you're working with and how your exposures affected them just by looking at the proteins and genes, which I thought was very fascinating. And how I chose this area of study was kind of interesting. So at UIT, that's the university I went to, me and my friends would sit at the Tim Hortons. And every time we were there, like during classes or during our breaks, there was a huge aquatic omics lab poster. I remember first year, and I was looking at it and I was very intrigued. I was like, there's a fish lab somewhere on campus. It's like secretive, no one knows where it is. So I just decided to hunt it out. And I found the PI and just started asking questions. And she was really passionate about proteomics in general. Um, and it piqued my interest. And ever since then, the rest was history.
That's so fun. That's so exciting.
It was so exciting. I loved it.
So I'm sure during your undergrad, you met some people that applied and didn't get into med school, or if you know of anyone. Um, and if so, like what alternative career paths did they decide to take?
Yeah, so there was some students I know who applied in Canada and didn't get in, so they applied in the States or the Caribbean. But for students that didn't get into med school at all, they kind of went towards other healthcare disciplines. So one of my friends is actually now an occupational therapist, which is amazing. Like a lot of people, I didn't know what occupational therapy was until I got into med school and until my friend got into OT. There's also PAs, so physician assistants that I know some people went to. Those are the two main healthcare disciplines I know that my friends went towards when they didn't get into medical school. But that just goes to show you that there's so many different paths to medicine. Medicine doesn't just mean physician, it means healthcare as a whole. So there's a path for everyone. And then, oh, some people also did their master's and PhD instead and focus more on clinical research.
Would you say that a lot of people like don't get in, like wait and then apply again, or do they typically just like take another career path afterwards?
Yeah, so it's a very different for everyone. In my personal experience, so I've applied twice. The first time I applied, I didn't get any interviews, nothing. Like I was so distraught and heartbroken. So my options were I could take a gap year and do nothing, take a gap year and work, or probably pursue something like a master's. I decided to work for a year, and I worked alongside a chiropodist, which is another healthcare professional, but they are a foot specialist. So throughout my year, I learned a lot about how to be patient centered. And then I help with dispensing things like orthotics and doing a lot of ad hoc jobs. And I think that was very helpful for that, for myself.
That's really great. So you mentioned that U of T was your dream medical school. So why is that, and how is it different from other schools that you applied to?
Yeah, I can go on and on. I love U of T so much. One thing I really loved about U of T is the way their curriculum is set up. It's very holistic. So, um, yes, learning the pathophysiology of various diseases is important, but they also focus on how to be a good physician by being more humanistic, for example. And I really appreciated how they had weekly tests rather than I know some schools they do more like midterms. And the weekly test helps you to stay on top of your work, and it's also lower stake exams. Um, so I know a lot of my classmates, and I really appreciate that. Um, U of T is known for their great student support. So we have something called OLA, Office of Learner Affairs, where we get a lot of one-on-one support, such as therapy or career advising, which is always very helpful. Another thing about U of T is their emphasis on clinical exposure early on. So I remember after our first week, after orientation, the first Friday, we started already at the hospitals learning how to take a patient history. And that's very helpful because I don't like saying practice makes perfect, but good practice makes not even perfect, but is good.
Like better.
Better. There you go. Thank you. Um, and then we also have something called FMLE, which we get matched to a family physician one on one, and we go into the clinic and just work with that family physician, which I really appreciated. One more thing, I told you I can go on and on about UofT, but I'll say this last thing is the plethora of opportunities available just because how big and established UofT is and the location and the networks it has already formed. You'll never not have an opportunity available to you. Sometimes it's even a little overwhelming, to be honest. But yeah, I can't speak for other schools because I don't go there. Um, but this is what I know about UofT.
That sounds great. Um, so you mentioned orientation and things. So when you started medical school, what was different from what you were like expecting, or what was surprising,
Ooh, good question.
if there was
Yeah,
anything?
there definitely was. I think there was this misconception that once I'm in medical school, my life is kind of over. It's no more social life, no more extracurriculars, no balance, and I'll be stressed all the time. And it was the complete opposite. I remember during our stethoscope ceremony, so U of T, we don't have a white coat ceremony, it's a stethoscope ceremony. Um, one of the uh, physicians came and gave a speech and said, "Don't forget to stop and smell the roses while you're on your medical school journey." Um, and I really took that in and was able to have an even greater, or not greater, I shouldn't say, but a more fulfilling social life, I believe, in medical school. I was able to do intramurals, and yeah, I learned so much.
Yeah, I'm sure a lot of people like that are considering it too have heard that it's like with the work once you get in, it's like really overwhelming and that, you'll have to sacrifice things like social life, but that's good to know.
Yeah, very true. Like you definitely you'll have to make sacrifices for sure
Yeah.
depending on how busy it gets. But again, balance is looking at the whole picture, right? So maybe on a Monday I will not be able to see my friends, but on a Friday I will after an exam.
You mentioned one-on-one career like counseling or mentoring. Um, do you think you could talk a little bit about the mentorship programs at U of T?
Yeah, absolutely. So again, U of T has so many opportunities. Um, so I participated in two more formal mentorship programs. One was the diversity mentorship program and the alumni mentorship program. So for the diversity mentorship program, you are paired with a physician, again, one on one, and they really focus on that diversity, equity, inclusion aspect, and you both complete different activities together that helps to foster that. But more so than that, you also get someone that can you can ask questions about, and you can shadow them. So I was paired in the first year with an anesthesiologist, a very sweet, like we still text and communicate, and I keep her updated. Um, and then this year I was paired with an ENT. So it was good to see various healthcare disciplines. And then for the alumni mentorship program, very similar. You're paired with a physician, and they're there for you to support not only your professional development, but also more so your personal goals, which I really appreciated. And then last thing is shadowing. So at UofT, by the end of your second year, you're supposed to complete around 30 or a little more over 30 hours of shadowing. So that's a good way to get connected with various physicians and just learn the ropes, and hear about their story.
So is that unique to U of T, or is that also available at other medical schools?
Good question. I think the shadowing aspect, I might be wrong, is kind of um, all medical schools, at least in Ontario, you should complete a certain amount of hours. In terms of the specific mentorship programs, I'm not too sure, but I would, I'm very confident that they would have similar types of programs.
So what's been the most challenging aspect of medical school so far?
Hmm. Ooh, you're asking me really good questions. I'm like, just one? No, I'm just kidding. I think for medical school, it's the integration of all the knowledge you're learning. So, for example, in undergrad, you take a course, you kind of memorize, regurgitate, and you tend to forget. And that's something that in medical school doesn't offer you as well, because you're expected to kind of remember this information and put them together. So we have, at least UofT, we have progress tests every so often, and these progress tests have questions from the past and new material as well, all put into one question, and you're supposed to be able to kind of use your clinical reasoning to answer these questions. And again, this is a skill that comes with practice and exposure, but it's been pretty challenging. Like, I remember my first progress test, I did terribly. It was so bad, but we have our learner chart, which is our online portal that has all our grades and our assignments. And I've seen a steady progress in my progress test. So that was pretty good.
I'm sure it's helpful later too when you need to like refer to things that you've like learned or like looked at earlier.
A
So,
100%.
on a more like positive note, what's been the most rewarding aspect of medical school?
Um, Most rewarding, I think, personally, the self growth I've seen in myself over just, I'm entering my third year right now, but just over the 2 years, um, seeing how much more confident I am taking a patient history and how I'm better at presenting patient histories to physicians, or how I'm better to reason clinically. It's when you first start, it's very intimidating, and it looks like you're looking up at a mountain that you'll never be able to climb up. But based off of how UofT curriculum was built, you can really see your self growth, which was super, super rewarding. And I think this sounds kind of cheesy, but like the friends I made along the way, honestly, have been the really most rewarding part, actually, of medical school.
How have you been managing stress? Like you mentioned, the workload and also like studying for tests and how heavy that is. So what like methods or strategies do you use to manage that?
I'm very intentional about um, setting time, or like time blocking. So I love Google Calendars. I love the coded aspect of Google Calendar. And every day I set at least an hour to myself to do, whether it's intramurals, extracurriculars, um, doing a full-on skincare routine. That's very important to me. And then once a week, I have a longer block, more than just an hour, to do something I really enjoy. And that has kept me sane. And I think also humans were social beings. Even though I'm an introvert, still making time for my friends and family has really helped a lot.
Like kind of also with managing stress, like how do you maintain the work-life balance?
Yeah, so one thing is I try not to procrastinate. So if there's even a little bit of time to do something, I do it because that helps keep me balanced in a sense. Because then later on, when I'm having my 1 hour block, I can do whatever I kind of want without having to stress about other materials. And also, the way our curriculum is set up is that we have 1 day off a week to do kind of like whether it's shadowing, um, studying, etc. So that kind of helps keep us balanced. Just the schedule that we're given is really forgiving, at least in first and second year. I'm not too sure how third year is going to look with the clinical rotations.
So you are going into your third year, so I'm not sure if you've looked into this a ton, but what does the process of applying for residency look like?
Yeah, I haven't. I should have. I haven't looked at it too much, but so with the residency match, at least in Canada, we use a portal called CARMS. And then I think you require a CV that includes your academics, research, volunteer experience, etc. You also need your transcripts and your, I think it's called the MSPR, your medical student performance record, which will have um, kind of what you did or how well you did during your clerkship, so third and fourth year. It has usually comments from your various preceptors, um, and also just a general like who you are as a person. And then you need, I think it's 3 reference letters. And then once you put that into the portal, you also have to rank which programs you want. So, for example, I want to go to UBC's pediatrics as number one. Number two, I want pediatrics at UofT, etc. And then, based off the algorithm they have, they'll match you to the school. And then you also have an interview process. So I think the interviews before that matching happens.
How likely are you to like match with one of the like programs that you've applied for?
Competitiveness of different programs will affect that match rate. So something like ophthalmology is very competitive, whereas something like family medicine, although still very competitive and coveted, is not as again. There's more seats available. Actually, right now we're in a family medicine crisis. We need a lot more family physicians. So it really depends on what you want to do and the school's competitiveness.
How will you decide what specialty you're going to apply for your residency?
Yeah, so earlier I did mention one of my weaknesses is my indecisiveness. So I'm very indecisive in terms of what medical specialty I want to do. Um, so I've thought of my main right now is family medicine, pediatrics, and maybe gen surge. So those are kind of all really different, but some questions I use actually, I'm going to pull it up right now. I use it's called the Roadmap to Choosing a Medical Specialty, and I think it was adopted by Brian Friedman. And there's just a list of questions they have listed. So I'm just going to pull it up here. And those are kind of the questions I've been going through and journaling. When I shadow, I kind of answer these questions. So the questions are: what are your areas of scientific slash clinical interest? Do you prefer a surgical, medical, or a mixed specialty? What types of activities do you want to engage in? And then how much patient contact and continuity do you prefer? So some people like in Emerge, there's not really continuity. You see a patient, they leave, whereas family medicine, like you get to see that patient grow and you get to really know your patients. Other things that might be more taboo, but I actually appreciate a lot of the physicians that talked to us said that compensation and lifestyle should be considered. Again, if you're going to do this for the rest of your life, you should be thinking about those things. Um, So those are two things I want to definitely start to prioritize thinking about more. Um, yeah, those are some of the questions.
How does the job market for certain specialties change over time?
I feel like depending on what's going on outside of medicine will have a huge impact on what specialties are um, doing well or not doing well or have a bigger job market. So it's kind of hard to say if it's really consistent. Sometimes it is. For example, family medicine always need more family physicians, whereas I've heard things from some of my colleagues like orthopedic surgery, at least in Canada, they have been struggling with having enough um, surgery time or like um, OR time, so in the operating room. So it's been harder for them, especially with COVID. There was a lot of backlog of surgeries. Um, so again, it really depends on what's going on outside of medicine.
So, would you say that there is quite a bit of demand for physicians once you finish your training?
Absolutely.
Like,
Yeah. I think even with orthopedic surgery, like, yes, it is a bit harder than before to find enough OR time, but there's always a need for various specialties. And then I mentioned earlier, like, when you have your CARMs, they have a certain amount of seats available for different specialties, which helps kind of stabilize the job market. Because if everyone wants to be a dermatologist and we let everyone become a dermatologist, then the job market won't be too good. So it's well controlled, I think.
so you mentioned that you co-founded the Wellness of Women organization. So what kind of work do you do through that?
Yeah, so with Wellness of Women, we wanted to focus on filling a gap in our local community. So in Oshawa, there was high rates of shelters for women specifically. Um, and they were kind of struggling getting donations and funding, and they kind of needed a voice of empowerment or somebody to advocate for them. So what we did is we hosted various fundraiser events. So one of our most popular was the packing party. So throughout the year we do things like bake sales, and then with that money we buy different items that the shelters needed, and then we would get our general members to kind of put the packages together, write nice notes and encouraging notes, and then we would deliver them to the shelters. We also raised money for different bursaries and scholarships for people who were in the shelters. And then I think one thing that was very important and valuable was the education component. So we would host a lot of workshops and seminars to kind of talk about misconceptions about the plight of women, not only around the world, but also locally. So those are our main kind of initiatives.
Your general members, is that within your university or also like just like in your broader community?
It was definitely when we first started just with the university. Um, But as we transitioned and passed it on to uh, the next group of execs, we kind of, in our transition report, asked them to maybe expand out to people outside of the university just to have a bigger and better outreach. And I've kind of reached back out and heard that it was a very successful um, way to broaden the network. And they've been doing very well. I'm really happy.
That's great. So just to finish off the interview, what advice would you give to high school students like me who are considering a career in medicine?
Ooh, some advice. Um, For me, I think what one thing I regret is not journaling and reflecting enough about my various extracurriculars and experiences. I think that would be helpful not only for applying to med school, but also learning more about myself and developing my skills in a more intentional manner. I think by doing this, you're setting yourself up for success because once you're more self-aware, you're able to grow, I think. Start developing good habits now. So if you know you're a procrastinator, try to again not procrastinate or like find ways in order to motivate yourself. so that you're not leaving things to last minute. Because once you're in med school, leaving things to last minute is a lot harder, and um, there's a lot more material. So start developing these habits now, and then use the resources available to you. So I regret not using mentorship early enough, and I think even in high school you can find mentors now. So have you heard of the community of support?
Don't think so. No.
So the community of support is offered through various medical schools, and they help students with their MCATs, like offering MCAT courses or linking them or matching them with mentors, giving them career advice and counseling. And I think it's available to high school students as well. So using those resources available to you. And then one last thing is I mentioned the CAN meds earlier. I think it's super important to develop those competencies via various activities, but again, not doing it in a checklist manner, but doing it in so that it's continuous. So if you love cheerleading, do that and do it for as long as you can, and try to take more leadership roles as you develop through that one activity.
Thank you so much. That was really, really helpful. It was so nice to have you on today's episode.